I think we will go ahead and get started. Good afternoon, all. Welcome to the HFMA Colorado Chapter webinar series. We are so glad you're here. We want to take a moment first to recognize our annual business partners who not only provide financial support to our chapter, but also share their knowledge and experience through speakers and presentations just like these. Their support allows us to operate our chapter and bring our members quality education and resources. We hope that you will take a look at them first when your organization needs any services or support. A reminder to all that certification is now included in your HFMA membership. Study materials are all available online, and all modules can be completed on demand at a time convenient to you. If you have thought about getting certified or looking to advance your career, contact the chapter to get more information about certification. NASBA CPE credits will be available for this webinar. In order to be eligible for those credits, you must complete all 3 of the polling questions throughout the webinar. We have experienced some difficulties with the polling mechanism, so if you are unable to actually answer via the poll, please just go ahead and populate your answer in that chat box. All right, today's webinar, Data-Driven Relationship Building, is brought to you by one of our gold level business partners, Centauri Health Solutions. It's my pleasure to introduce you to our speaker, Nate Clark. As a member of Centauri Health Solutions strategy and analytics team, Mr. Clark works with healthcare systems nationwide to identify growth strategies and opportunities, as well as implement data-driven initiatives across a variety of outpatient fields. Mr. Clark attended Christopher Newport University and obtained his bachelor's degree in history. He also holds a master's in healthcare administration from Utica College. Please join me in welcoming Mr. Clark.
Well, thank you all for joining today. I'm going to go ahead and pull my screen up here so that you all can see the presentation. Excellent. Jessica, can you confirm everyone can see that?
Looks like we're on the notes page, Nate.
No problem. How's that?
Perfect.
Great. Well, thank you so much to HFMA Colorado for having us. Really appreciate that introduction. Thank you. And thank you to everybody who's on today to learn a little bit about data-driven relationship building. I'm going to dive into exactly what I mean by that and break it down a little bit here in a couple slides. But just as a quick overview, yep, this is me, Nate Clark. I'm an engagement manager with our Referral Management Analytics division here at Centauri Health. I've been here for 2.5 years. I just going over my credentials, my education credentials there, but I've worked in healthcare for going on a decade now. I started in the U.S. Army as a combat medic, and I've worked in clinical service lines on the administration side, though. I've worked in insurance, I've worked in long-term care, I've worked in pharmaceuticals, so I've been a little bit of everywhere. You know, I love working in healthcare, and I love working with organizations in my current capacity. For Centauri, we do, as was mentioned, we work with health systems kind of all across the country. Our focus is on outpatient referral-driven service lines. So we take an approach of looking at service lines that are kind of driven by more retail habits, right? So anywhere where you have someone in the referring community sending a referral, whether it be for services like imaging or lab work, or for specialty care, whether it's surgeons or ENT or any of your specialty service lines, anywhere where that relationship is necessary to get those referrals, that's kind of where we operate. That's where our green space is. And we kind of have 4 tenets in our approach to that I think are going to inform the way we approach relationship building and the way that we recommend that our clients, and by extension, everybody on this webinar, think about or challenge themselves to think about relationship building. So one is that obviously it's relational. Increasingly, what we're seeing in the industry is that there are tons of health systems or independent organizations with which primary care physicians or other referring providers can choose to operate with or send their patients to or make their top choices. And we find that that is often driven by just the general relationship that they have with them. We think that that begins by having individuals committed to outreach and committed to visiting and growing and developing the relationship between the referring community and a health system. We do that with a data-driven approach. So we're strong believers in maximizing your resources by identifying where they're needed most. And we're going to talk throughout this presentation about ways in which you can do that, ways in which you can use the data that's probably already available within your organization to go out and make the most use out of your relationship building assets. We believe in actionable solutions. So we are strong and firm believers in the idea that what we bring to the table or what you're bringing to the table should be something that you can implement for results quickly, right? So a plan that should be able to generate some results immediately upon implementation. And then finally, we believe in measuring results. So this ties right back into our data-driven approach. We want to collect more data to identify whether or not the actions we're taking are having an impact. So we're gonna talk about kind of each of those steps, how we do it, how we encourage our clients to do it, and how we think you all and your organizations could benefit from utilizing as well. So before I go any further, I want to define what I mean when I say data and what I mean when I say relationship building. I'll start with data. There's a couple different categories here. They come from a few different places. So I'll start with third-party data. This is probably something that most of you are already familiar with in your organizations. It's something that you probably access with some sort of regularity, but this is non-proprietary data. So this is data that you're getting from a vendor, generally speaking. And usually it comes in the form of claims data. So this is data that comes from oftentimes CMS in conjunction with whatever insurers or payers that vendor works with to generate their data. This is always really good, interesting data because it captures your market usually. Because it's not proprietary, it's going to capture information about your competitors as well. And that makes it really valuable, but it has some limitations as well. And we're going to talk about those as we move through the presentation today. But one consideration that should always be top of mind when it comes to third-party data is that generally speaking, at best, you're getting it on a quarterly basis, though oftentimes it's even less frequent. It's 6 months or a year before you're getting it. And there's some serious limitations there in terms of using it as the primary source for the data that you're going to use to drive relationship building. We'll talk a little bit about that. There are 3 other types of data, though, that we look at and that we think all organizations should be looking at on a regular basis, which are proprietary and internal to your organization, and you're probably using some of them, maybe some more than others. The first is your billing data. So this is actually taking a look at what has made its way through your revenue cycle and your revenue management team, and what exams or services have actually been billed for. Generally, we look at this all the way down to the CPT code level, and we use that to build out our reports. We're going to show some examples of those. There's also order trends or order data, and this is a little bit distinct from building counters, and I would say is most of the time the data that we find our clients are not leveraging, and maybe is the one that's newest to you in your organization. But only a certain percentage of the referrals or orders you receive from the referring community are actually going to convert into a billed exam. So patients don't show up for their exams, or once they're called and given a price estimate, they decide not to go forward, or you're unable to reach them entirely. It never actually ends up on the calendar to begin with. But because it comes in real time, right? You're receiving these orders every day, generally in your central scheduling departments, or within your practices, if your practices are doing the scheduling locally. Because it's real time and because it's not impacted by operational factors like a failure to convert, it is probably the strongest metric in terms of measuring your relationship strength with the referring community, specifically with referring providers. Finally, the last piece of data is usually is outreach efforts. So this is actually measuring the work that your professionals, your outreach business development professionals are doing in the field. Generally comes from a CRM. Salesforce, I think, is the one that everybody's probably most familiar with. But there's a bunch of different CRMs out there, and you may be using something different at your organization. We use a tool called Creatio, but I know there's probably a dozen or so big ones out there that people use. So that's those are kind of the four general buckets that I'm referring to when I talk about data. And as we go through and we look at the different types of reporting and the different ways in which you can use this data to categorize and optimize your outreach, I'll be specific in terms of what data we think is most useful in those. Relationship building. When I say relationship building, we are referring specifically to outreach efforts by dedicated professionals. So these are your biz dev, your marketing, your physician relationship managers, your community relationship managers, whatever their title might be. But the teams that you have that are dedicated and committed to going out and making connections with the referring community. It's those efforts to build relationships and drive referral volume. That's what I'm talking about when I say relationship building. And when you bring those together, which is what we're advocating for here, is the use of data in that relationship building effort, you're using that data to categorize providers, and we're going to talk about those categories, and we're using that data to optimize and make sure we're making efficient outreach to providers based on the trends that those providers are sending in either their order trends or their billing data or their third-party data. So what does this typically look like in clients that we work with? And maybe some of these will resonate with you as well. And what do we think it can be at its best? And you'll probably recognize that you're utilizing some from both of these columns. Typically what we find, though, is that organizations are using static call routes for their outreach professionals. So their biz dev teams are rounding on a set number of providers, or they're rounding on a set geography or service line. And those are updated based on some lagging indicator data. Again, usually yearly data dumps. Maybe you have a yearly strategy session where you focus on a couple of service lines or providers that need a bump in the year to come. But the problem with that is that your teams are not getting data frequently enough to pivot to different changes in the trends of referrals. So as an example here, if you've had a provider that's sending to you good steady volume for 12 months and then starts to decline in their referral volume 3 months in a row, but you don't review your data except for every 6 months or every year, by the time you identify that trend, they've fallen into a new referral habit. They've fallen into a new practice. And you're going to have to go out there and try to undo that change in habit that they have, rather than just nip whatever concern was irking them in the bud. The only thing that can potentially kind of give you an opportunity here is if a provider is lodging complaints or escalating service concerns. And frankly, unfortunately, that just doesn't happen often. A provider is just more likely to start using a competitor than they are to go through the trouble of escalating something to you and your organization and try to get it fixed. So oftentimes you've got really limited resources. So, we've seen teams as small as 1 or 2 individuals for a healthcare system or for a individual hospital or facility that's trying to cover all of the service lines that are offered and trying to cover the primary and secondary service area of that organization. And they're, again, for efficiency's sake, they're developing these call routes, but they're not necessarily going to where they're needed most because they just don't know where that is. And that feeds into some of the problems that we see with the data itself. Is oftentimes the tools that have been developed, the data that is available, is hidden behind design that is geared towards leadership teams and analysts, and not geared towards somebody who should be spending 90% of their time in the field and 10% of their time looking at the data. So it's not built in such a way that a referral or outreach liaison can quickly look and say, here's where I need to spend my time today. So, we propose call routes that change as frequently as they need to based on referral trends, the utilization of real-time data as much as possible, and the deployment of your resources into places where they're needed based on data that they can access and interpret themselves. So this brings us to our first poll question, which is, do any of these limitations apply to your organizations? I'll give everybody a moment to answer.
And while we're waiting on those answers, I just wanted to mention your sound is going in and out just a little bit, but I'm not entirely sure what's causing it.
Let me see, maybe if I move my microphone a little closer here. How's that?
It sounds great now, so.
Okay, all right.
All right, thank you.
I'll stay hunched over here. You all are just getting a close-up of my face now. Great. So it looks like there's one person out there whose organization is really on top of this, and hats off to you. I mean, that is rare to find. Great work to you and your teams. For everybody else, you're not alone. I mean, this is very typical of what we see. And for those of you who are unsure, again, not atypical of what we see. So hopefully what we go over here in the rest of the presentation will be helpful to all of you. If I can get my slides to move. There we go. So again, the first thing that we want to do with data when we look at it is break our refers out into categories that are easy to understand and have specific action items associated with them, so that our marketing and outreach liaisons, or your marketing and outreach liaisons, know exactly how to spend their time with these different groups of people. The first group is our new refers. So these are your real green space refers. These are people who have either sent their first referral, or if you're looking at third-party data, have never sent a referral to you. And there's a unique approach to them that you want to use to try to get ongoing business relationships with them, ongoing referral-driven relationships with them. Your second group are your strong relationships. So these are kind of the cornerstone of your referral-driven business lines. These are people with long-running referral trends who are also showing growth over the long haul. So it's tempting to look at one or the other, right? Growth or just pure volume. But really, choosing one of those doesn't tell the whole story. And we're going to get into that as we continue as well. Finally, the last group are your growth opportunities. So these are providers with flat or underperforming growth, even decliners, folks who are sending less now than they did in previous months or previous years, or people who are maybe showing good growth, but still are not sending you the volume that you would anticipate from them. If somebody's growing by 10% every month, but you're only capturing, 20% of their overall volume, the question still remains is where is that volume going and how do we capture it? So we would encourage you to approach that growth opportunities group with a broad mindset, and to remember too that you may have a provider who sits in different relationship categories based on which service line you're talking about. So you may have a provider who's sending you maybe a lot of business to your imaging department, but really never sends you any oncology or surgery work. And the question becomes, how do we leverage the strong relationship we have in one service line to build the strength of our relationship in another? So we'll talk first about new refers. We're going to talk about some of the reports that we use to identify them and how those are helpful. We'll talk a little bit about the data that we use to do that. But just to get kind of an overview of what this group looks like, there's some real opportunities. First off, you haven't captured any volume from them yet. So every exam or every referral you capture from this group is incremental growth over the prior year for that team. So you're not reclaiming business that you lost at one point. This is true new opportunity. These folks can come in a few different ways. I mean, usually they're new providers to the market, but Oftentimes there'll be people who are loyal to a competitor and are displeased with their service. Maybe they worked for a competitor and have just struck out on their own or have changed organizations. So there's a few ways that these folks can show up in your data. But anytime you've got an opportunity to go out and try to win them over so that you can develop an ongoing relationship with them, it's an important opportunity. There are some challenges to finding these folks. So oftentimes in your data, they can be misidentified. What I mean by that is they might be providers from out of state who just referred a patient who was on vacation near them and had to go to a doctor. They can often be folks who are rotating in or out of a location or in or out of a role very briefly. And so it is important to scrub this data for clarity's sake. We automatically eliminate anyone outside of the state unless the health system is close to the border of another state, in which case we'll include both. We have our liaisons, and your liaisons really know their communities. They're the ones embedded out there. They'll have a good idea of who some of these people are right off the bat. Another challenge is that they're not going to show up in your proprietary data, with some limitations and caveats on that. Because they've never sent to you, by their very nature, they're not going to show up in your billing data or your order data. We get around that in two ways. One, we will often use third-party data to identify these new opportunities. CMS is a great resource for that. That's free if you're not purchasing claims data already. The CMS database is available to you, and while it's not always up to date, it can be a really good place to start. You can also just look at providers who have sent you the first referral on record and kind of categorize them as new referrers, so people that you want to continue to capture from. And we'll look, our next example is going to be a report that shows that. But it does require persistence to convert these individuals. Oftentimes, if they're new to a market, they're sending a lot of different places, or they're really letting their patients drive where they want to be sent. And so it's important to go out there and continue to work to establish that relationship. We can talk about ways in which you can do that. In terms of identifying these new providers, though, this is an example of a report that we built, and the logic that the report effectively sits on is it looks back at billing data and tries to identify if an individual provider has ever sent a referral before, if there's any volume from them on record. We look at this at the service line level. Again, just because someone has sent to you for some lab work before doesn't mean that they aren't new to your radiology department or your surgery team. And so it is important to treat those as discrete and unique encounters, just because service levels can vary. They can have different preferences based on past experiences. So you want to treat someone as a new referrer anytime they're sending to a service line for the first time. So what this report does, and I'll take kind of January of 2021, for example, is it looks at providers who sent their first ever referral in January of 2021, and it tells us how many they sent. So each of these providers sent one. If you look in February, you'll see there's a provider who sent 2 referrals for the first time in February. And then it also looks at an ongoing basis to identify which providers kind of catch on and continue to send volume. So if you look in November here, you can see there's a provider who sent once in November of 2020, then sent again in December, then sent again in February. Whenever you see one of these folks pop up and you capture their information, it's important that your marketing and outreach professionals go out, thank them for the referral, ask all the kinds of important probing questions that allow you to capture that business. How did that initial referral go? Were they able to get through okay? Did they have any questions or follow-ups that they needed assistance with? We also advocate for the delivery of a thank you note. If they referred to a physician, a thank you note from that physician. Even if it's just a form letter with a signature, or if it's from a department, just a form letter from the department, as well as your typical marketing materials that encourage them to refer again, give them pertinent phone numbers, that kind of thing. And Jessica, I'll just ask, is my audio coming through better now?
It's crystal clear most of the time, and then it seems to just get muffled intermittently. I don't know if there's a chance your hand is covering a speaker every once in a while, but it doesn't look like you're moving much either, so I'm not sure.
No, I'll try my best here to continue.
Right there is nice and clear.
All right, I'm not going to move a muscle. This is another report that we use to identify new opportunities in the market. It's based largely on the Medicare claims data. So again, this is data that you can access without any cost to yourself. Obviously, it takes time to get analyzed and processed and put into whatever tools that you all are using, but the data itself is available to anyone publicly. And what we do is we look at the referral volume that a provider has sent over the last 12 months, and we try to identify whether or not we're capturing a sizable percentage of that, or whether they're entirely new to us. So in these circumstances, we can see the trailing 12-month volume, and we can see that that's about 7.5% over what we would expect a primary care practice with about 140 providers in it to send over a given 12-month period. For these others, you can see that they're sitting below the benchmark. If they're sitting at 0% of the benchmark and their trailing 12-month volume is 0, you know that that's a provider that has never sent to you before and you have tons of opportunity with. This is helpful. A report like this is helpful because it's using some impartial data. It's using that third-party data to identify how much a provider should be sending or how much they did send overall within your market. And then it can use your billing data to capture what percentage of that you actually managed to bring into your organization. So a report like this is great because it gives you a full view of your market, both the business that you are capturing and the business that you're not. And for the business that you are capturing, how much opportunity you still have to be able to go out and grab some more of that business. So really anyone who's underperforming benchmark would be someone that you would think, okay, we've still got a chance to go out and capture more business from them. The next two groups are growth opportunities and top referrers. And I think I said earlier, new referrers are a discrete group. Growth opportunities and top referrers are as well. They're approached in different ways, but they really are just two ends of a spectrum. One side kind of being the cornerstone of your business, and the second side being a group that you have the strongest opportunity with outside of new referrers. The good news is that because you're looking at this based on whether or not they're growing or declining and whether or not you're capturing a comparatively large or small volume of orders given what you would expect from that provider, it's pretty easy to use proprietary data to capture this information. So this is information that's already in-house. You don't have to go anywhere else to get it. And for better or for worse, these are referrers that are at least aware of your health system. They know who you are. They've got some existing relationship with you. So it really becomes a question of, do you need to go repair that relationship? Do you need to go manage that relationship? Or do you need to go continue to strengthen it if they're already a strong referrer? There are some unique challenges with a group like this, or rather with both of these groups. The data can be clouded, which, with any data, you're going to get what's called noise, which is just factors that are complicating the data in a way that obscures the real picture for you. A provider may look like they're underperforming in a given month or that they declined when they're really just on vacation. You may have a situation where, a provider has left the market, and so it looks like they or their practice have declined when in fact they're just down a provider. There's all sorts of little unique challenges, catastrophic weather events, that kind of thing can all have an impact on your data. It is possible, especially by coordinating closely with your market liaisons, who will probably be the first to know about these changes, to mitigate those impacts and to get a good, clear, full picture. These analyses are at their best if you can get them as real time as possible. So one of the challenges is to get this information into your system, cleared through your analytics team and out to your your referral case managers or your outreach professionals as quickly as possible. And then finally, there's a lot of different ways to review this data. Again, you can look at raw volumes, you can look at percentage changes, You can look at volumes versus revenues. So there's getting your team on the same page in terms of what they look at and how they measure success in and of itself can be one of the challenges here. We'll give some tips for that as well as we move along. Before we go any further, though, I'm curious to know, is your organization already identifying the new referrers that we discussed?
While we're waiting on some answers, we did actually have a question populated in our Q&A box.
Absolutely.
And it was early on in the webinar, outreach personnel. By that, do you mean service development representatives, SDR, or inside sales?
Yep.
/ inside sales.
Great question. I think what we refer to when we're talking about outreach personnel are the folks responsible for actually going out into the referring community and meeting with providers to try to develop these referral-driven service lines. So, you have your marketing teams who maybe are developing marketing materials and are, managing your website and your social media presence. This is less geared towards them and more geared towards the people who are actually out there trying to grow the service lines and help providers connect. A lot of times they wear different hats. Sometimes it's, these are folks who are actually doing provider ride-alongs. You hire a new specialty provider or you hire a new primary care provider and they're the ones taking them out and doing introductions. So I hope that answers your question.
I think just a little clarification. So client executives, sales executives, and business development teams. Does that sound accurate?
Yeah, I think these would be these. Yes, I think so. I mean, there's a lot of titles for these, so it's a little bit tricky to answer your question. But yes, I think those are the folks that we're talking about, right? And it's those professionals who are going out and working on that business development. Now, this would be depending on what kind of organization you're a part of, right? I mean, if you're part of a healthcare system, then yes. If you're part of a pharmaceutical sales or something like that, these look a little bit different, but a lot of the same principles apply.
Thank you.
Yes. And then is your organization able to identify any referrers? It looks like a few of you are already, which is great. We have found this is one of the reports that a lot of our clients are lacking right off the bat. And it's when I talked earlier about actionable changes, things that you can implement right away. Usually we can develop this report really quickly. And so that's great that you guys already have it. For those of you who don't or are unsure, these are a great opportunity just because there's so much green space here and you can get the information you need with the data you likely already have. So excellent. Well, we'll talk about increasers and decliners here, and we'll use this to kind of start off our conversation regarding identifying your strong referrers and your growth opportunities. Your strong referrers are going to be those people over here on the green. The color coding obviously makes it probably a little obvious, but these are folks who are showing growth over the previous year. And what we do is we tend to look at the trailing 3 months compared to that same time period the previous year so that we can mitigate for things like samples that are tainted by a weather event or by a physician being out of office. We want to get a big enough sample size that we're comparing like to like and that we're eliminating some of the noise and some of the fluctuations that happen naturally in the data. Your decliners or your decreasers over on the other side are the folks that really need some sort of attention. This top physician, I've got the names start out here, obviously for the protection of our clients, but this physician is down 39 exams compared to the prior year. It's a pretty significant decline. You're talking about almost 13 a month at that point. So these are the people that your marketing and outreach personnel need to be able to quickly identify at the top of their day and say, okay, I need to go out and meet with these people. Something is going on. They're down over the last 3 months. Having it structured in this way makes it really easy for somebody to know where to go. We spoke earlier about the fact that oftentimes the data is in, an Excel workbook that's in some sort of giant table that's really hard to track or follow, sort and filter. Sometimes the data is just structured in such a way that it's useful for an executive level person or a director of a service line, but for the person who needs to quickly know where to go visit, it's not structured in that way. This was designed specifically for our liaisons to be able to see who's up, who's down, and they can spend their time accordingly. At the bottom, we show the overall volume so that it's easy to kind of see the general trend and filter. When you click on one of these physicians' name, it'll filter that volume over time at the bottom there as well, that line graph. So you can see, even if they're declining over the last 3 months, are they up so substantially in terms of the trend that you think you've got them on the right path? So it's both the change and the trend that are valuable here. Another really useful tool is provider benchmarking, and we looked a little bit at something similar to this in one of the reports we saw for new referrers. But understanding how a provider is performing compared to their peers, while not the end all and be all, can give you an idea of what your opportunity still looks like with a group of providers. In this case, we were looking at some imaging service lines, CT and MRI. And you can see that there are providers here who are dramatically overperforming their benchmarks, which is great, but you can see some that are underperforming their benchmarks as well. In those situations where you have someone underperforming, there can, again, be some limitations to the data. If you have a provider that's only in office part-time or something along those lines, obviously they're going to underperform their benchmarks. Again, these tools should all be designed in such a way that you're handing them to your outreach and marketing personnel, and they are going to use their good judgment, their knowledge of the field, along with this data to prioritize and structure their approach to the market. One other challenge here is that this can be difficult to build because you obviously need a large sample to build your annual benchmark for these specialty lines to know how much they should be sending, whether it's referrals to a specialty provider or to something like CT or MRI. It takes a large sample size to get a clean picture of what that should be. We're fortunate in that we work with, markets all over the country and health systems all over the country. And so we can build our benchmarks based on all of that data that we're collecting on a monthly basis. But this is something you can get maybe from the CMS data, or if you're buying third-party data, there's another opportunity to capture some of that there. You don't ever really want to lose the forest for the trees. So again, just sticking with the imaging service line here, which is a lot of the work that we do, you want to make sure that you're also observing how the service line is doing as a whole, not just at the individual provider level. And you want to look at both volume as well as net revenue. As you know, there's a mixture of reimbursements for various services, and you don't want to draw too much concern if you've got decline or slower growth in a low reimbursing area. If you're getting really good growth in a high reimbursing area, they can be offsetting each other. So it's important to make sure you give a full breakout of both the individual level, which is useful to your marketing and outreach professionals, but also reports like this, which can be more informative for your service line leaders, or even your health system executive level folks. This is just one other report that you can use to both get an example of something you could do to get both a high level breakout as well as kind of individual performance. Having just a summary line at the top or the bottom can be really useful in getting a sense of kind of where you stand and who's contributing to that. So this is something that we find is really useful to kind of have the summary line for your leadership, and also the full breakout for your individual marketing and outreach personnel. When they review together, if you sit down monthly to discuss performance or annually, it gives you an opportunity to kind of break it out, and the marketing and outreach personnel can speak specifically to the overall performance by kind of drawing the eyes to examples in performance. I see we have a question. So we were asked, do the benchmarking metrics get skewed with recent changes in focus due to COVID? How much of a shift has been away from elective procedures, and is that data weighted against previous years pre-COVID or only year-over-year statistics? I'm sorry, I'm going to take a drink here before I answer this question because it's a really good one. I think I can speak for a while on this, but yeah, the answer is yes. COVID, the impact of COVID on data that we've received from our clients and that we use to build out our reports is pretty extensive and has required folks in the data world to get creative with what they compare to and what they measure against. The good news is that I would say initial impacts from COVID were heavier around the March, April, May timeframe of last year. And then individual markets seem to be getting these waves of Delta variant that are impacting the data in their individual markets. So, if you're with a health system in Florida, you're probably seeing a lot of impact over the last 3 weeks. If you're in West Virginia, I think the numbers are going up there, and maybe you'll see some impacts there. But what we can do is, one, we can compare. We have the benefit of comparing against various markets. So given the circumstances right now where outbreaks seem to be more isolated, or not isolated, but more localized, I guess is the better word there, we're able to compare to other similar markets. If you are in a position where you're using your proprietary data, you don't have other markets to compare to, then a lot of our clients have asked to compare to their 2019 performance and to shift our benchmarks to just take volume from 2019, which was less impacted by COVID. It's imperfect, obviously, because the question becomes, what growth might you have experienced during 2020 had COVID not had such a substantial impact? But one way you could look at that is to look at historic growth each year and project out based on the averages what you might have seen in 2020, if that makes sense. Hopefully I was able to answer your question. I would be happy to speak at length on this. This has been a real, we've seen most of our clients default to the 2019 comparison, but we've seen some really creative and interesting ways of comparing data given the impact COVID has had. Sorry, was there another question, or is that the same question? Okay. One thing to keep in mind with all of this data, I mean, everything we've shown you has some factor of lagging indicator to it, right? So everything that we've looked at today, you're waiting for results to take place before you can react to them. And oftentimes that just means waiting too long. Measuring your outreach efforts are kind of the leading indicator of relationship changes. So you measure how much outreach you're making, how much effort you're putting into relationship building, and then you can use some of this lagging indicator data, some of this performance-based data to get a sense of whether or not you're having the impact that you want to have. So we're going to look at a couple of reports now that show you ways in which you can quantify and identify your outreach efforts, and then tie them back to the performance metrics that we talked about. Ultimately, volume, revenue trends, these are a proxy for relationship strength, but are so subject to noise that the feedback you're getting from the field and that your outreach personnel are collecting is the best indicator of how things are going. So this first report is really just tracking outreach themes. As your folks are out there in the market, they're collecting all of this information. They're talking about different things. They're promoting different service lines. Having insight into how much time you're spending on any one of those categories is really valuable. And to do that, you need to be able to bucket kind of the general themes that you're discussing out in the market so that you can get some sort of quantitative measure. If you're just looking at notes, just freehand notes, it's kind of hard or difficult without a lot of analytical lift on the back end to pull out any quantitative analytics that can be helpful to you in an aggregate setting where you're looking at a broad spectrum of data. So we use our CRM, and we encourage folks to use their CRM to create kind of theme buckets so that you can identify how you're spending your time. This can be useful both in terms of identifying whether or not you're spending your time on the topics that are important for the organization's growth, as well as identifying service level issues. So you can see in this example, the team here spent a lot of time on promoting low-dose lung CT screening, waned off of it a little bit, and we were reminding them that was still a high priority for the organization. They started to spend more time on it, and that continued to grow in further months. You can see also, pushes in mammography. Sometimes those are discrete efforts. Sometimes they're sustained over a long time. Our mammography efforts, we always see those spike in October coming up here. Could be a great testing ground if you all want to measure, how much effort you're putting into your breast cancer awareness month programs. That's one area that you can measure. But this bottom section here is more a measurement of service level complaints that folks were receiving about the central scheduling department. So the outreach and marketing reps were hearing an increased number of complaints to where they were needing to assist an office with scheduling an appointment where they couldn't get through to the central scheduling department. And again, this can be as real time as you want it, right? If your outreach and marketing professionals are putting their themes in daily to your CRM, you can pull that data and put it into a visualization like this that allows you to quickly identify if there are complaints. If there are complaints, you are likely going to see a corresponding decrease in referral volume. At the very minute level, we also encourage call logging, so quick overviews, notes that allow good interactions between frontline managers and the frontline outreach and marketing professionals to get down to really exactly what they're talking about in offices, what they're hearing, what the feedback is. And we produce these on a monthly basis, and we recommend reviewing them on a monthly basis so that you can dial in specifically to what challenges are being faced by the referring community. This is good for supporting the quantitative data that you're gathering. There can be good anecdotes in here that are useful in kind of understanding some of the trends that you're seeing. The real value of all of this, though, is when you kind of tie both of them together. So when you get a sense of how your outreach representative visits or the amount of time you're spending with an office is impacting their referral trends or their growth. So this is kind of a quadrant view breakdown. On one axis here, you've got your outreach representative visits, so the number of times they're visiting an office. And then you've got your year-over-year trailing 3-month percentage change. So basically how much they grew over the last quarter compared to the same time the prior year. And you've got different categories that you can use to quickly kind of think about these. This is really helpful for your outreach and marketing professionals in that they can quickly identify who they want to spend more time with and who they've already got in a good place. If you're spending very little time or very few visits and you're getting good growth, that's somebody that you really just want to keep happy. If you're spending a lot of time there and you're seeing good growth, you want to find a way that you can kind of move them into the keep happy bucket. You've got your group that you're spending a ton of time with and you're not getting a lot of change, you're not getting good growth from. With that group, those are people that you need to either identify, one, what obstacles are we not solving for them with these visits? Or two, are they someone who's just really ingrained in their practice of sending to a competitor and we're not going to move and we can spend our time elsewhere? And a good place to spend that time are with people who aren't growing that you're not visiting very much. So this is just kind of an easy structure to use to think about the referrers in your community and where to spend your time. Smart dashboards, what we call smart dashboards, are another really good tool. these utilize your CRM data as well as your referral data, similarly to the quadrant graph that you saw above. But what you want to do is make it easy for a rep to see people that they haven't visited in a while who are declining. So, you want to see folks that you haven't been to maybe in the last 3 months that are down more than 20%. You can kind of set the parameters wherever you want to. But a tool like this allows an outreach person to really, really quickly look and say, okay, anybody with a red X, I need to make sure I've got on my list for a visit this month or in the next 2 weeks. So I'll ask our third polling question for those of you who are out there tracking. I'm curious, is your organization tying outreach to referral trend? Are you kind of taking that final step where you're not measuring just one or just the other, but using reports that combine both of those data sources? That's great. It looks like a good number of you are. For those of you who aren't, this is kind of I think the gold standard is when you can see both brought together. These are some of the most valuable reports that you'll have access to. So, a couple of just general rules of thumb. Make sure you're tailoring the data to the audience. We talked about the fact that your marketing and outreach personnel are oftentimes looking at data not designed for them or not presented in a way that's designed for them. Similarly, make sure that you're not providing super nuanced, granular data to leadership. You want to give them a sense of what's going on. You want to provide visualizations rather than just tables wherever possible. Tables are great. I'm a big data nerd, so I love a good table. But when you're presenting out to senior leaders or even to your folks who need to get granular, oftentimes diving into a table should be kind of the final step. And then, of course, just make sure you're sharing data out at appropriate intervals. Get a cadence together that works for your outreach team and the leadership at your organization so that they can report out on the progress that they're making. You can align strategic objectives that way, and everybody's viewing the same data with the same context. So in summary, this is really just a cycle. You want to identify your provider groups, make outreach, collect data on the back end after you've made your outreach, perform your analysis, and then evaluate whether or not you need to change your outreach efforts. If your outreach efforts are not effective, how you can change those. And then you recategorize folks. So if you've got a new referrer who's been sending to you for 6 months now, the question becomes, are they growing? Or are they sending you the same number they've always been sending? And then make your outreach accordingly. So you should be in a constant cycle of reevaluation of the data that you're receiving. Just an overview of how RMA can help with this. For those of you who may be interested, we manage all of the personnel for a lot of our clients who do this. We manage the outreach personnel. We have leadership for those outreach personnel. I am one of the analysts who works on the reports and building them out. We can help with process and workflow management. So whether or not that's the building of the data and visualization tools, or building patient tracking systems, those are all things we can assist with. And then the smart dashboards, referral trend dashboarding, results and scorecards, that's all support that we provide to our clients each and every day. We have a whole suite of services in addition to that. We work with growing the referral volumes with the outreach teams, but we also have teams that manage the referral cycle from start to finish. So you've got your teams out there who are growing the service lines, but once you receive those orders, oftentimes there's there can be very obscure tracking of those orders and identifying where they're at in the system. We take a very retail and patient and provider focused approach to that, and trying to give them insight into where they stand in the referral process. And then our strategy and analytics supports both of those functions, both our referral growth and our referral cycle management side. There's a list of clients here for anybody's interested. We work with, like I said, folks all over the country. We're very pleased and privileged to work with some excellent healthcare organizations. I'm very proud of the work we've done there with them. We do assessments, we do growth engagements, we do referral management engagements. So we can work in a discrete manner in which we're doing kind of a one-time overview of your services, providing recommendations similar to the ones that you've seen here, but customized based on what you already have in your organization and where we see opportunities. And we are happy to stay on and help with that growth and help with that referral management over the long haul. And then, of course, we have services outside of just referral management and analytics. Centauri offers Medicaid eligibility and enrollment services, out-of-state Medicaid claims assistance to help mitigate the number of uncompensated care cases you have due to out-of-state Medicaid. We have referrals or revenue cycle analytics, risk management, quality, and eligibility services that we offer as well. I'm happy to help direct folks to all the right people if you have questions about that or to speak more about referral management and analytics. But I'll open it up. We've got a few minutes here for any other questions.
Thank you so much, Nate. We really appreciate you providing your expertise and your time to us today. While we're waiting to see if any other questions pop up either in the chat or in the Q&A box, I do just want to remind everyone that a copy of this presentation is available. You can download that off of our website. I'm sure if any questions come to you afterwards, Nate would be happy to answer them offline. And I believe, is your contact information in the presentation? I think it is.
I believe it is, yes.
Okay, great. So there's a great way to contact Nate if you have any other questions. Certificates will be made available within the next 2 weeks once we've been able to verify participation and check those questions and all that stuff for your NASBA credits. I am not seeing anything else pop up at this time, but of course, as we mentioned, you can always contact Nate offline. Thank you so much for being here. We really appreciate it.
Thank you so much, everybody. And thank you, Jessica, for having us.
All right, that concludes our webinar today. I hope that we will see you all soon at another webinar or at HFMA Colorado's virtual Fall Summit here in October, the 7th through the 8th. Thanks, guys. Have a wonderful day.